In this lesson, I'm really excited to be talking to you all about the initial care of the newborn after delivery and how you're going to provide that care. All right, so the infant's been born. Now, what are you going to do with it? What's going to happen? So, the infant should be placed skin to skin on mom if it is stable. Skin to skin is awesome, does lots of awesome things. So, it can help or it will help stabilize the temperatures for the baby. It's going to help stabilize the heart rate, respiratory rate, also blood pressure for the baby, and even does blood sugar, blood glucose. So lots of awesome things. It's also going to help with bonding. And if the mom wants to help with or wants to breastfeed, it's going to help with that initiation of that first feeding, getting everything started. So when you place the infant skin to skin, it's going to be important that the baby is completely been dried. Okay. So we don't want a wet baby on mom because the baby's going to get cold. So dry the baby. It's going to need a hat and a diaper and a blanket on its back just to help keep that heat in and, keep the baby warm. All right, so those are our things that we're going to do, skin to skin, all good things. So our assessment of the baby, assessment's going to be very important because this is going to be that initial first assessment, see if there's anything going on, anything wrong. But if the baby's stable, it's going to be more important to keep that baby skin to skin at first, as long as there's no concern with the baby. So our assessment can be done later. There will be an initial assessment done that we will talk about called the APGAR score, and that can be done on mom's chest, but our full head-to-toe assessment really needs to be done under good lighting. We can really look at the baby. So while this baby is on mom, we can also do vital signs, and those will be done frequently for monitoring. So those are typically done every 30 minutes. For the first 2 hours of life. So this will include our heart rate, our temperature, and our respiratory rate. All right, our assessment is going to be really important, but the very first assessment the baby's going to get is called the APGAR score. This is okay to be done on mom, remember, and it's done on every baby. So every baby is going to get this. It's done at 1 minute of life and at 5 minutes of life. Our goal is to get a score of 7 or greater. APGAR stands for, it's a mnemonic, so A for appearance, our P for pulse, G grimace, A activity, and R is respiratory. So the babies will score 0, 1, or 2 points in each category. So the highest they can get is a score of a 10. So you can see on this table over here how they can score a 0 if they have absolutely no heart rate is detected, no respiratory effort, they're limp, there's no grimace, their color is blue or pale. So then if they will get 1 point if their heart rate is there, but it's below 100. Respiratory rate, if it's just there, but slow, irregular, not really strong yet. Muscle tone, if they have some flexion, they're not all the way limp, but not completely active. Some grimace happening, like pull back on being stimulated. And then color, if they are pink but have blue extremities. Now, I'll tell you with the color, a 1 is very normal. It's very rare that the baby would get a 2 for color because their hands and feet are the last things to get pink. And this is called acrocyanosis, a completely normal finding in a newborn. The body is working super duper hard to get the good oxygenated blood to the vital organs, and the hands and the feet just aren't those vital organs right after delivery. So it can take several hours for them to pink up, completely normal. Now, 2 points you can see are going to be given if the heart rate's over 100, we have good crying, the baby's active, showing reflexes and responses, and is completely pink. So a good score is above 7, if you remember me saying. If we get to 5 minutes and the baby scores under 7, then they are going to get another score at 10 minutes of life. And it will keep continuing, 15 minutes and 20 minutes until they get that score above 7 or they've decided that there's nothing else they can do. If they have a good score, even if they have a 10 at 1 minute, they are still going to get a score again at 5 minutes. So always a 1 and 5. We want at 7, and then they will do a repeat again at 10 minutes if it is under 7 at that 5 minute point. All right, so after the APGAR score, the baby's going to need additional assessment, right? We got a whole head-to-toe assessment to look at. So we're going to observe things like respirations. We're going to see that they're regularly irregular. So with this on a baby, let's talk about what that means. So we breathe at a regular rate. A baby is going to breathe, 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 stop, hold their breath for 10 to 15 seconds, and which can seem like forever when you're watching them. And then they will all of a sudden breathe, breathe, breathe again. So they have these little periods of apnea, and that's okay. And that's normal. So don't panic. I was a tech in nursing school, and I remember I was giving a bath in the nursery to help one of the nurses out. And I told the nurse in a panic that the baby was not breathing. The nurse smiled at me and just said, they do that. It's normal. And she pointed out a few seconds later, the baby started breathing so fast again just to catch up. So I tell you that story so you won't be concerned like I was and, panic. So you also will see the parents will notice this. Sometimes they don't notice it till they go home, but just important to tell them a completely normal thing. So they breathe, 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 stop, catch their breath, and then breathe, breathe, breathe again. So they are regularly irregular. That is their normal. With our respirations, we are going to be clearing any secretions that are there. Our respiratory concerns that we have are things like nasal flaring, grunting, retractions. So these are things that we're going to look for. So our nasal flaring is going to be when they open and close their nares, trying to pull in more air. Grunting is this little noise that they make to help kind of pop their lungs open. And it is if you think of an adult, when they get CPAP, to help keep their airway their lung field open, that negative pressure. Grunting is the baby's way of giving itself its CPAP. This is going to get very tiresome for a baby. We'd prefer just to give it some CPAP instead of them providing themselves their own CPAP. So just another little noise that they will make. Retractions. This is when the rib cage is sucked in as they're breathing, looks so uncomfortable, and pull down to their spine. And that's them also just trying to really force that air and pull air in. Our vital signs. So we're looking at temperature, respirations, and heart rate. Typically, babies are not getting blood pressure checks unless they are in the NICU or if there's a cardiac problem that's detected. So these will be the vitals that you'd be getting. And then measurements. We're going to measure their head circumference, chest and abdomen circumference, and then also get a weight and a length on them. So our management. This is going to involve promoting thermoregulation. We need to keep that baby warm, right? And then also just safety of the newborn. So the baby's born, and if needed, the physician is going to use that bulb syringe to suction that mouth and the nares out. You can also do this if needed. And I say if needed because it used to be done on every baby, no matter what. And now new guidelines are recommending that it's not the case. They just need it on a case-by-case basis. So if there's a ton of fluid and they need to be sucked out, or if the baby has had meconium in utero, then we'll suck them out also. If suctioning occurs, it's going to be mouth and then nares. And that's important to remember. The reason why is because the baby's first breath is a large inhale, right? So he or she's going to suck in any fluid or whatever is in that mouth. So we want to suck that mouth out so they're not inhaling that large amount of secretions or meconium, whatever it may be. And then do the nares. Drying. So really important. Drying is important because we want to dry them quickly. We want to keep them warm. So this is going to help get them dried off. Get the fluid off of them so they don't lose heat by evaporation. And also as you're drying them, it's going to stimulate them to breathe and to cry. And that's really important now that they're out of the uterus. So this will be done kind of firmly just to help get that baby dried off. Now our delayed bath. So baths used to be done like right away, right after delivery. Well, it has been found that if we delay the bath, it means that it's just better for the baby. We want to delay them until they're stable. And you might think your baby's stable at, 2 hours of life, but I'll tell you, newborns, they can change with a snap of your fingers so quickly. So you always have parents that are just like, okay, when are you going to bathe this baby? When are you going to get that stuff off my baby? They got blood, amniotic fluid, vernix, and even meconium if the baby has had that bowel movement in utero. But delayed baths are really important. So if you think about, if you've learned about hospice patients or those that are close to dying, you've probably heard that if you give them a bath, they might probably die. Well, this is not an old tale. This truly happens. So the bath just relaxes them, and it also adds stress on their body. So in a newborn, if you give a bath too early, it can actually throw them over the edge and put them into respiratory distress and have some difficulty. So we really want to delay this for 24 hours until they're 24 hours of life. Our golden hour. So we want to promote golden hour. This is the first hour after the baby's born. We want that baby to be skin to skin with mom. We want the baby to be bonding with the family, and that is going to be the first hour. So we're going to promote that time. Medications. So medications that we give are vitamin K and erythromycin. The erythromycin is that eye ointment. We're putting it in their eyes, just eye goop, to clean out their eyes, and then that's to protect them from if the mom had any chlamydia or gonorrhea. But all babies get this because chlamydia and gonorrhea is one of those that really a lot of times is asymptomatic, so they might not know they have it. But to protect the newborns from that, so that because they could go blind if they contract that. And then vitamin K, this gives them what they need for blood clotting. They're not born with it, and their liver is not mature enough to make everything that they need. So we will give them that at delivery as well. And this needs to be done when the baby is 1 hour old. So right after that golden hour. All right, education's important, right? New parents, they have this awesome baby and no idea what to do. So they need to know how to use the bulb syringe. You aren't going to be in the room the whole time with them or go home with them. So they need to know how to use it if the baby starts to spit up any secretions. They need to know the importance of skin to skin. I've had so many patients that think they're going to be grossed out when that baby's born because the baby will be covered in blood and vernix, and they say they don't want the baby on them. So having a conversation beforehand just to let them know, sometimes once the parents hear how important the skin to skin is, then they're on board with it. So just talk to them before and educate them on that. It's just the best way, you can tell them to regulate the baby's temperature and regulate the baby and keep them safe. I have literally had babies on a warming table that are grunting, having some mild respiratory distress. You put them skin to skin on the mom's chest and they instantly stop. It's crazy, but amazing. Our medication education is needed. So typically, you give medications to your patients and you're going to educate them on that. Well, now we got to educate the parents because we can't really explain to the newborn. So we're going to educate on that vitamin K and the erythromycin, just because those are those first medications we give after delivery. And then just keeping the baby warm. So they're going to have visitors that want to look and count every finger, every toe. They want to see the size of the baby. They want to see the baby's hair. So they want to take the hat off. They want to undress them. So it's really important to educate the family that this is very important to keep the baby warm. So just keeping a hat on and keeping them swaddled and covered, or if they're skin to skin, keeping a blanket on their back. So safety, thermoregulation, and clinical judgment will be our concepts, our nursing concepts. So caring for this newborn is all about safety. We have to make a lot of clinical judgment to just determine how the baby is doing and if there's anything we need to do for intervention. And then because we cannot keep temperatures stable, we need to really work on thermoregulation, or since the baby can't stabilize at temps, we need to work on thermoregulation and make sure we are preventing any cold stress from occurring. All right, let's review all these important things. So bulb suctioning is done to clear the airway. We need to clear so the baby can breathe, right? So skin to skin is also going to be done, and this is important for regulating temperature, blood sugar, blood pressure, heart rate, and respiratory rate. And we want to do this for the first hour of life, that golden hour. Thermoregulation is going to be very important in keeping that baby stable. So just ensure that that baby is dried very well and the hat is put on the baby and blanket on the back. Our APGAR score. So this is done at 1 minute and 5 minutes, and it's our mnemonic for appearance, pulse, grimace, activity, and respiration. Remember, our max score is 10, and we want to get a score that is over 7. And then initiation of feeding. So we are, whatever the mom chooses, either breast or bottle, we're going to help initiate that first feeding. And then monitor and interventions. So for that first 30 minutes, we're doing a lot of frequent monitoring. Those first 30 minutes for every 30 minutes for 2 hours, sorry. We're going to be getting those vitals. After that golden hour, we're going to give vitamin K and erythromycin. And then we do our full assessment. We'll get the weight, the length, the head, the chest, and the abdomen measurements. So make sure you check out the videos that are attached to this lesson, review the key points as well as deciphering the APGAR score and just different scenarios to give different scores. Now go out and be your best selves today. And as always, happy nursing.